Hey crew, welcome to the MMOA podcast. My name is Shelby Blankenship. I am one of your level 2 and live TAs and a physical therapist. And today we are going to be talking back on Baker's cyst and going into a little bit further on in the plan of care than we did a few weeks back when we first started seeing this patient for Baker's cyst. So just to kind of recap of what we're going to be talking through, we're going to kind of go through the different points of like what I was trying to include in every session as we've gone on through her plan of care. And then we're going to kind of talk through what specific things I was finding, any other little tidbits that I thought was really helpful. And I want to kind of just make sure that you feel comfortable going into tomorrow treating a Baker's cyst and kind of progressing that plan of care. The first thing we'll go through is when it comes to a Baker's cyst, you always have to remember, and Extremity Division did a great little post about this a few months back, if you want to check it out, that we are treating the symptoms, not necessarily like the actual like fluid sac that the cyst is. So most of the time when these things kind of pop up, usually arthritis is involved, meniscus, something's going on with that knee to start out with that's kind of creating an environment where that cyst is being created. So for when these sessions kind of go along, the biggest thing that you're going to see is there's going to be a big limitation in knee range of motion and especially in total knee extension. So that's the first kind of pillar that we're going to look at. Total knee extension is going to be a big part of your initial plan of care, and then it will progress as far as what that looks like. So when we first started with our individual, we were kind of working on total knee extension, either in like a long arc quad and doing a little extra with like a band. We were doing it with like a quad set kind of situation where we were also having the heel propped up and getting that little extra extension there. And then we were progressing to doing more of like a standing total knee extension with a band, and then progressing towards like a sled push and pull, banded walking forward and backwards, sideways, those kinds of things, because total knee extension is going to be super influential in not only her capacity for gait, but also the biggest thing for her is she is a dog walker. That is a big part of her livelihood. So we have to make sure that her knee strength, range of motion, all that is super, super incorporated into our plan of care, and also making sure we're creating longevity for that knee. The other portion, the other pillar that we're going to kind of tackle is we want to look above and below the joint. So especially with knee, it's really easy to kind of just get fixated on like hamstrings and quads, but we really want to make sure that we're going after calf musculature, especially like the gastroc. So I was really making sure that we were incorporating some calf length and strength. And what I did find is she was very, very limited in calf length and strength, especially on the side that was symptomatic for her. Especially when you went into more of like a single leg calf raise, like that was basically non-existent. And so that is something we've had to progress for her. Soleus was for calf raises that I love. I think it was in the Extremity Division as well that I saw this, where you have, if your right leg, say, is the symptomatic side, you will use a box, maybe like a 12-inch box or something that's like a little bit on the lower side. Prop up your left leg on that one, and then the right foot stays on the floor, and then do a calf raise there where you have a little bit of support, but you're able to get more full range of motion, and then you can load it as well with some weight, whether that is worn or held. The other portion that I also found for this individual that was a little, not, I wouldn't say surprising, but kind of one that I wasn't necessarily like super looking for, was hip flexor strength. So for her, I noticed when we were doing straight leg raises, like in a more supine position, it was okay. It was something that I was like, oh yeah, like I'm not surprised, like this is a limiter, but it wasn't like super, super bad. And then we tried to do some long sitting straight leg raises, especially just going straight up and down. And that side that was symptomatic was very, very limited. So it was kind of interesting to see like the quad component wasn't too bad, but the hip flexor component was very, very limited. Kind of wondering like, was this part of the components that made the knee kind of have some issues prior? Hard to know, chicken or the egg kind of situation, but always with these folks, you want to make sure you're looking above and below the joint to make sure there's not areas that are getting missed. The third pillar that we kind of attacked is, we want to make sure that everything we do with this lady is functional. So, we kind of had those little teased out components for maybe what I would consider like range of motion and like very tissue specific, but we want to make sure it's incorporated fully into the function of daily activities that she's going to be working on. So besides doing like sled push and pulling and like walking, banded walking kind of aspects, we wanted to incorporate some sit stands. We wanted to incorporate some deadlifts with carries. We also wanted to incorporate some step ups. And we wanted to incorporate some power movements, maybe even a little bit of jumping, especially with the amount of activity that she's required to do for her job as a dog walker. I mean, there's lots of play, especially depending on how big the dog is. You got to be pretty agile and pretty stout. And so we wanted to make sure that she could not only manage physical loads, but also power loads. So we incorporated some jumping and especially some floor recovery. Getting on and off the floor is essential for older adults, but especially when knee limitations can be a component into why people aren't getting on and off the floor very often. And so with her, we kind of started with elevated inchworms or elevated burpee modifications. And then we kind of decrease that to where she was getting more like on the ground without a box or without a bench or a couch to kind of help her so that she could have multiple avenues. Because especially when it comes to floor recovery, it's not that there's only one way to get on and off the floor. You got to make sure that they have components or at least have an idea of what their strategy is going to be so that if she did get knocked down by one of the dogs, she was able to get back up on her own, or at least have strategies to get to a phone or to get to something to get her more independent in that part of the part of her job care, because that can be super frustrating when you are like, hey, I feel really comfortable walking. I feel great doing stairs. I feel great, squatting down to get the items that I need to get for these folks. But when it comes to if the dog actually knocked her over or she tripped on something and had to get back up, she can't just, like let the dogs go and then try to do what she needs to do. She needs to be able to manage and know what her strategy is going to be so that she can feel more independent and more feel like less like burdensome when it comes to doing her job. It doesn't become such a obstacle to do her job. And then the last component that I think is a great supplement for your sessions is making sure you're looking at little accessory items. So one of the things that we talked about in the previous podcast is diet. She really, really struggles with getting enough nutrition. She's partially a caregiver for her husband, even though he's doing much, much better. They had a lot of stressors and a lot of things, especially limitations when it came to nutrition. And so that is an area that we have addressed almost every session, whether it's as simple as just following up at like, hey, can you take pictures of your food? I want to see what you're eating, see what ways we can optimize, and especially just trying to encourage overall nutrition, whether that's giving resources for meals that she could pick up and just throw in the microwave. We have a service that does that at our gym. And then we also have like little supplementations for protein. So things like Bear Bell protein bars or chomp sticks or things like that that are easy to kind of incorporate like while she's doing her job, but aren't necessarily like a full-on meal, but can kind of help at least progress the protein intake. And then I would also say, like, with stress management for her, this has definitely been an area like she is notorious for having like higher blood pressures, and stress management is something that is very difficult for her. So just giving her resources on like what's available to kind of help negate that or at least process that more appropriately. So we have a local social worker who specializes in the older adult population. And so we've given her that as a resource, but we've also created a caregiver support workshop that we're doing with this social worker in the next, it's at the end of this month actually. And it's just going to allow, I think caregivers get so often thrown um, into the second position. Like, right, they never put themselves first. They always are like, you know what, you eat. No, you know what, like, I'll do the laundry. I'll do all these things. And while all of that is really helpful, it ends up putting them on the back burner so much that they end up having more deficits and can actually have a higher mortality than the actual patient that they're taking care of. And so what we want to incorporate is making sure that there's a balance of knowing like, hey, there's some things that don't even need to be done right now. Like they need to get done, but it doesn't have to be everything doesn't have to be an emergency. And I think especially for a lot of my females who are taking care of their husbands or are taking care of like kid, grandkid that needs like more physical or mental assistance, it can be super, super hard for them to get enough nutrition intake. But also, they put so much on themselves and they don't want to ask for help. And so, having caregiving resources, having that listening ear of like, hey, I totally understand like what you're going through is really, really challenging, but we've got to like find a point during the day or once a week or something where you get a bit of a break because you can't sustain this forever. And especially, I've noticed it more when it's like a spouse kind of situation. That dynamic between their spouse has completely changed. And that can be super, super hard for both parties, but especially when you don't know how long this disease process or this diagnosis that they're dealing with is going to last. There's no end in sight. And there becomes like, it's one thing when you're like, I just got to buckle down for a week. But when it turns into months and years and even decades, that is just not sustainable. And that's where we see a lot of issues. So that's an area that I have really tried to kind of encourage and give my patients like a spot to have like that, like a little bit of grief, but also give them a resource of like who to go to. Like that's not my job as far as a physical therapist to teach like what to do, but I can at least give them the avenue of like, this is a really good person who's going to help you navigate those issues and navigate like what you're internally feeling and not feel guilty about it. So that's one thing that I would suggest. But the last thing that I would suggest, and I found this to be super, super helpful as well when it comes to Baker cyst, is compression garments. Now, there is a multitude of levels when it comes to compression garments. Like I think it's like 8 to 15 millimeters of mercury, 15 to 20, 20, it goes on forever. For most of these folks, depending on the level of swelling that they have, I usually start with 15 to 20. It's still in the over counter, like you can just order it online. They can do, depending on like the level of severity, I try to do like the knee high socks because it kind of gives some nice compression and just gives some nice support, especially for my individual who walks a ton and is very active. It allows them to maintain that activity level without swelling being such a pain component. Because I found that most of the time the pain is limited more to the swelling and not necessarily to like specifically something going on like with the knee. So I would try that. I have found good luck with Bombas. I'm sure there's tons and tons of other options out there. They seem to have like the most color options, which most of my folk get very frustrated when there's only just white or black or tan. They want something with a little bit of color, a little bit of fun. So I would check those out. I would also say, when you get past like 20 millimeters of mercury and on, it tends to be something that like has to be like medical grade and might need like a prescription and those kinds of things. And that might just be something that you might not want to jump there first. They tend to not be as comfortable and they tend to not adhere to them as often. So I would start small and do either the 18 to 15 or the 8 to 15, excuse me, or the 15 to 20 and start there and see how their adherence is and see if that helps with their symptoms before I would go on to something that's a little bit more stringent or robust when it comes to the compression garments. So just to kind of recap what we talked about with Baker cyst, we kind of talked about what the pathology is, but knowing that we are trying to treat the function of the actual human, not necessarily trying to get rid of the cyst of behind the knee. We kind of focused on total knee extension is going to be a huge one, starting with starting with like long arc quads, starting really simple, and then kind of progressing to like forward and backward walking, sled pushes and pulls, Spanish squats, those kinds of things. Those are going to help really precipitate getting that full range of motion of that knee. You can always add in knee mobilizations there too, depending on what their tolerance level is, especially if swelling's on board. That's something to kind of keep in mind. The second aspect is we want to look at above and below the knee joint. So looking at calf, ankle strength, especially like the gastroc that crosses that knee. And then of course, looking at like hip flexor strength. I have found that to be a limiter on folks when it's not really necessarily the one that I'm like looking for. I mean, quad strength is kind of a duh, but hip flexor strength is a little bit, that's a good little point to kind of add into, especially when you do like a long seated straight leg raise. And then the third aspect, we always want to go back to function. We want to incorporate that in every session we would do. Deadlifts, farmer's carries, floor recovery, stairs, squats, adding in some power components, like use those sandbags, use some jumping. We need to have that power component as well, especially as we're progressing in that plan of care, especially with my females when we know osteoporosis, osteopenia are something that we're probably going to have to address with this individual at some point. And the fourth is those accessory items. So compression garments, if appropriate, making sure we're battling nutrition, especially if we have a thought that like osteoarthritis or any of those like inflammatory components are a part of the condition that we're treating. We want to make sure that diet's in a good spot, not only from protein intake and making sure we're getting recovery, but also blood sugar regulation and making sure that we're fueling appropriately, especially if somebody's pretty active. And then we also want to make sure we're managing stress. Again, going back to the inflammation, but just overall stress can really be a limiter when it comes to people's recovery, and we want to optimize that as much as possible. As far as older adult stuff that we have coming out live, we are going to be this Saturday and Sunday, January 10th, Greenville, South Carolina, in Fort Myers, Florida. So hope to see you there. And then January 24th, we're going to be in Santa Cruz, California. I'll be there. So if you're coming, please come and say hi. And then L1, we have the next cohort starting January 14th, and L2 will be February 9th. We hope to see you there. Hope y'all have a great rest of your week, and happy 2026.